Hi, everybody. Happy Wednesday. Thanks for tuning in to our Facebook Live. My name is Lauren Carpenter. I do our social media and PR, and here I have Lucy with us today. Hey, Lucy, thanks for joining.
Thank you.
Yeah,
Nice to
so
be here.
yeah, it's awesome. Yeah, I'm glad you could take time and chat with me and with our followers. So, how long have you been working at HBAF?
So I actually started in October of 2019. This is actually my 3-year anniversary, so
Awesome.
that's cool. I have held multiple roles here. I was hired on in October, but in August I started my internship. So it was kind of cool to work here part time as a rapid rehousing program screener. So
Okay,
yeah.
yeah. Um, so what is your background in like I guess social work or case management?
Yeah, so I got my master's degree in social work with a focus in mental health and addictions. I Prior to getting my master's degree, I worked with caregiver homes. I did like an internship there. So I got to really work with the age and disabled population and create care plans and kind of work with the healthcare system and specifically with the Medicaid waiver and kind of learning about all of that. So that was really a great experience. And then this has pretty much been my first job since graduating with school.
Yeah, and congratulations on 3 years. It's awesome.
Yeah.
We're happy to have you here. So, what is it that you do? Like, what's your title? And I guess, excuse me. What does your day to day look like?
Yeah, so I am the healthcare navigator here at HVAF. The healthcare navigation was a program that started at the fiscal year of 2021. So I've been in this role for about 1 year now. It's been really awesome. It was a brand new program that the SSVF office really urged healthcare navigators to start and really just help veterans with care coordination and accessing, physical health care, and then as well as like mental health and preventative services and so forth. And so I really will help veterans in identifying, a healthcare plan to really identify what their barriers are and highlight their strengths that they have, and we'll build that care plan, and then I will also, like transporting them to medical appointments is a big one. I'll help them, filling out insurance paperwork, whether that be if they prefer to go to the VA or community health resources. So my role is to really focus on the healthcare part.
Yeah, and so I guess like why do you want to focus on the healthcare field?
So the SSBF office, when they started this program, they, I think it was back in 2018, they conducted research with the SSBF program as a whole, and they really found that there were specific barriers that veterans had. That might be they had diagnoses that were undiagnosed, and they had chronic health issues, and just being homeless in itself might impede focusing on their basic needs rather than going to a doctor's appointment, or if they didn't have childcare, or and so forth. So they really recognized this need for it, and so my role has kind of been to, it's more of an added service to SSVF, and it takes the load off of case managers that are already working with multiple clients on their housing needs, and it allows for me to really work with them and provide that transportation or be more one-on-one with them and really figuring out what they need.
Yeah, and now from when you first started in this role to now, just what's been the impact like with helping all these veterans in this way?
It's been really neat to see. I actually had started out in March of 2021, where we were housing homeless veterans and putting them in hotels. And I had said back then, at that time, when we were placing veterans in hotels, you could really see the stress and really notice that, they weren't focusing on their, engagement with their ongoing care, with their health care. And it's been really awesome to see, just even, helping veterans get an emotional support animal, and really seeing, just the different things, providing them with a wheelchair. That was really a cool thing for a veteran that had, limited mobility and couldn't walk. So it's been really awesome. It's been a really welcome service to the SSVF program, and I could definitely see them continuing this for quite some time.
Yeah, and how many veterans have you been able to serve?
So I've actually served over 80 veterans.
Wow, okay.
Yeah, so it's been a lot.
Yeah.
And then also, like I said, I think I remember getting a list of 250 veterans in our program when it had first started, and it was, all for the COVID-19 vaccine. And so it has been really a great program to, really help veterans access healthcare.
Mm-hmm.
So
yeah, for sure. Yeah, and we've been able to work together a little bit, because last year, if you guys follow our blog, and I saw that, Randall was able to get his wheelchair, and then just recently Cecil, that's been popping off on Facebook right now with his puppy. So yeah, it's been really cool to see how this program has been able to help so many veterans. So that is really cool. So why would you say that you like working for HBAF and like for veterans specifically?
I really like working here. I feel like it's a great collaborative and very teamwork focused. I've gained a lot of knowledge on, just from other colleagues, and just, I had never worked with the veteran population. So starting out as an intern, I really gained a lot of a knowledge from my supervisor, and that was really really neat to also be able to work in various roles. I feel like had I not worked as, the screener and then the hotel specialist and then now as the healthcare navigator, I just wouldn't have that experience, working with veterans one-on-one and having just a breadth of knowledge. So, and I really enjoy working with the veterans. It's really been a learning experience. So,
yeah. Well, yeah, like I said, we're happy to have you here and love the work you're doing. So thank you so much for talking with me today. And make sure if you guys want to, the stories that we talked about and, more are on our blog. If you go to hbafofindiana.org, and be sure, if you haven't liked our Facebook page yet, be sure to hit that like button, and also feel free to share this video onto your feed so people can know more about HBAF and the good work we do and can help us end veteran homelessness. So thank you guys for tuning in. Thanks again, Lucy, and have a great rest of your day, guys.